everyone, I'm Natalie Kunzman, MD, and today we are talking about acne. So, acne is an inflammatory skin condition, and so many of us are quite familiar with that because we may have gone through phases of that when we were younger. So, to explain the treatment of acne, we certainly need to go down to the anatomy of the zit. So our skin is made of the epidermis, dermis, hypodermis, subcutaneous tissue, and there is a rich vasculature, hair follicles, sebaceous glands, and support collagen structures within that dermis of the skin, which is what may go faulty in the acne-prone skin. So there is a lot of interplay over those things that can cause acne. And again, I like to explain this as not so much a skin condition as it is an internal issue that is getting manifested as a skin condition. So to the core of the treatment, we need to consider diet as the foundational base of treating inflamed skin, because that's initially where it's coming from. So a lot of people that have poor gut health, that are noticing a lot of inflammation and leakiness at the tight junctions in the intestinal tract, can allow toxic debris and inflammatory pathogens and toxins that are trying to detoxify throughout the skin layer. Now, sugar is pro-inflammatory, and then of course there's a lot of chemistry in our junk food that is just not recognized by the body, and if it's not recognized, it's being considered a toxin, again to try to detoxify and get out of our system. So sugar is very pro-inflammatory, so I tell all of my people with acne-ridden skin that we may want to consider an autoimmune paleo approach to skin, which is going to wipe out all the sugars. It's going to get rid of all the toxic junk food in our lives. It will get rid of the grains and the nuts and the inflammatory foods that are triggering this kind of skin. So diet is foundational. I also will recommend lots of water. There is also the hormonal influence when we are young, as it is influencing the sebaceous glands. So sometimes we may want to be on some hormone blockade with some spironolactone, some supplemental approaches, or in the case of some women, maybe even some birth control pills. Now, as far as a non-medical approach, this is where some of the supplements can come in and really help quiet down inflammation, such as adding in 2,000 milligrams of fish oils. Very low inflammatory, very reparative to the skin. Vitamin C is also very imperative and important to quieting down inflammation at the skin level. And if you've noticed some of the really aggressive topical skin treatments on the market, vitamin C is part of that. So vitamin C, I recommend about 2,000 milligrams a day. Back to some of the topical approaches and medical treatments for acne, vitamin A derivatives do a very good job at lowering inflammation, but also behaving as a keratolytic. In other words, getting rid of some of the extracellular epithelial debris. And an acne-prone skin or an acne patient doesn't exfoliate as well as the average person does. And in those trapped epithelial cells getting clogged into either the hair follicles or the skin follicles, this is where the blackhead may form, and we do not have the ability to release that blackhead. Now, of course, that blackhead has a lot of sebum in there. And the reason it gets its color is because that sebum or oil will oxidize and give that black discoloration. So back to the vitamin A derivatives, it does a very good job of releasing that epithelium so the sebaceous debris can come to the forefront of the skin and be washed away. That also means that we could take some vitamin A by mouth to help repair the skin. Vitamin D is also very good at helping with the skin, in particular vitamin D3. And when it comes to the daily care of this kind of skin, we don't necessarily want a lot of chemistry, which can harm that skin. We need enough to exfoliate. So what I have watched some people do is overprocess the skin and the acne gets worse. So we don't want any chemical exfoliation such as the benzoyl peroxides and some of the glycolic acids, in addition to using some of the mechanical exfoliation, which are the sand, the grit, the microdermabrasion. I would say we want one or the other. Some people do better with just a plain Cetaphil to just wash the skin without it requiring or without it having a whole lot of chemistry on board. So obviously we need to do this daily. A basic moisturizer would be necessary for this skin. And again, this should not be loaded with a full arsenal of chemistry. I have to always give energetic due where energy has its credit. And in particular, when it comes to acne skin, the sebaceous glands become a fuel source for the bacteria called P. acnes. And that is what will form the pustule or the zit or the cystic eruption from the acne-laden skin. And P. acnes can obviously be killed off by antibiotic therapy, but sometimes that can be harsh because those antibiotics will kill off our gut bacteria. But 450 nanometer of light wavelength, which is the blue light spectrum, does a phenomenal job at killing off P. acnes in a harmless way. So there are several strategies that you can get at your dermatologist's office where you can sit under the blue lights to kill off P. acnes. There are some handheld devices which are not as strong as what you can get at a physician's office, but the energetic arm of blue light therapy also does a wonderful job of managing acne and its flare-ups. There are aggressive techniques which are medical, such as cortisone injections and Accutane, which is a very harsh but effective vitamin A derivative that can quiet down the skin. But a lot of you will do well with just foundational support of a good diet, drinking lots of water, sleeping reasonably well, because that is when we will regenerate all of our cellular health, and a good daily cleansing and moisturizing routine. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.